Hi, my name is Elise DiMarco. I'm a clinical psychologist and specialist in cognitive behavioral therapy for anxiety and related conditions. I'm here today to talk about post-COVID reemergence and how we can deal with our anxiety and dread around coming back into public life after having avoided it for a long time. So I think many of us assumed that once we got the go-ahead to resume our lives in public, we would all feel ecstatic and jump into life with zeal. But the truth is a lot of us are feeling a lot of anxiety and dread around going back to life. And this makes sense when we consider what avoidance does. So in cognitive behavioral therapy, or CBT, we talk about avoidance as a main driver of anxiety. Because if we avoid something, a situation, a person, etc., we never learn whether or not we can tolerate that situation or that circumstance effectively. And so we just assume that we have to keep avoiding it, and we continue to feel anxious about it. So avoidance is really a problem where anxiety is concerned. And of course, during COVID, we were told we had to avoid, right? We were told we couldn't go out and we couldn't engage with other people. The result of which has been that we've all avoided for a year plus and are now staring down coming back into the world after a whole lot of time avoiding. Fortunately, in CBT, we have a really effective strategy to manage avoidance and the anxiety that comes with it, and that's what we call exposure. Exposure is a strategy whereby we gradually and systematically face the things we're afraid of. I should note that exposure need not be gradual to be effective, but I found with my patients that it's a much easier sell if you go gradually and face the things you're afraid of. So the way I would encourage you to approach the things you're avoiding post-COVID, again, certain situations, certain circumstances, is to make a list of all of the places, people, and things that you are dreading, that you really want to avoid, but that, of course, you can't avoid anymore. Depending on your particular circumstances, this might be related to your work. These might be kid-related places. It depends on the person, right? Everyone's got their own list. So make a list of all of the places that you're really, wanting to avoid and dreading, and then rank this list according to how scary these things are, from the least scary to the most scary. And then start out systematically facing the items on this list, starting with the least scary item and moving up and up and up until you get to the scariest item. What you want to do with exposures is you want to practice a certain item as many times as you need until you feel confident, okay, I can manage this situation. So for example, if one of your things is the mall and you decide, all right, I'm going to go to the mall today and it's really scary, go the next day and then go the day after. And go a couple of times until you feel like, all right, I got this. I think I can deal with them all, right? Then you move on to the next item on your list. A couple of things to think about with exposure. The first thing to remember is that you are facing things you have been avoiding. So probably you are not going to enjoy yourself during these exposures. The goal is not to enjoy these outings. The goal is just to get through them, to get there and get back, and to show yourself that you can manage these outings effectively and that you don't need to avoid them. That is the only goal. Another thing I want to note is that kids can do exposure too. So if you have kids who are scared about returning to the world, sit down with them and create an exposure list and let them, if they're old enough, really be the driver of this list, because that, having that sense of control and ownership can be really helpful. Say to your kids, hey, we're going to get back to life. We're going to do it gradually. Let's figure out what we're going to do, and let's make time to do all of these things on your list. Finally, you may be in the situation where some members of your family are really gung-ho about post-COVID life and others are not. And if you're one of the people who are not, it can be really helpful to talk to family members ahead of time. And basically to say to them, I know you're really excited about doing X, Y, or Z. I'm still a little worried about some aspects of public life post-COVID, so I'm taking my time and gradually getting back into things, and I ask for your patience while I'm doing this. I think this can be really helpful because it can set expectations with family members so they don't put pressure on you. It's also a way of saying to them, it's not you, it's me, right? These are things that I'm coming to terms with. I'm going to have to take time with it. Please be patient while I'm getting back into life. Hopefully, the strategies of exposure therapy will help you to face any of the things that you are anxious about and dreading as life reopens. If you have any more questions about this or other aspects of cognitive behavioral therapy, be sure to visit my website at drcbtmom.com. That's drcbtmom.com. Thanks so much.